Tanya Parus is the president and managing member of We the People Health and Wellness Center, candidate for Sarasota Memorial Hospital Board, and Moms for America Medical Freedom Specialist. Please welcome Tanya to moderate this medical freedom panel, sponsored by Mammoth Nation.
Well, hello everyone. This is very exciting because I just got to meet one of my all-time heroes back there. Without further ado, I'm going to introduce both of these awesome people on our panel today. These are the fighters in full force. Let's have Kimberly Overton, RN, and Dr. Peter McCullough out. Wow. We're in the presence of the biggest medical freedom fighters, I think, right now. Local level, national level. This is really a huge panel for us today. Let me just talk about who Kimberly Overton is. She is a critical care RN and the founder and executive director of Nurse Freedom Network. You also just rebranded.
Remnant Healthcare now.
Awesome.
Yes.
And Dr. Peter McCullough is a practicing internist, cardiologist, and epidemiologist here in Dallas, which is great. He has dozens of peer-reviewed publications, multiple testimonies, and has commented extensively on the medical response to the COVID crisis on major media outlets. All right, so as a mother of three, who is me, had to fight for my children's rights to medical freedom during the COVID-19 tyranny, because that's what it was. I want to commend you both for being really a true inspiration. So, every time I talk about my kids, I always start to tear up. So I'd like to start with you, Dr. McCullough, if you don't mind. Where are we right now in the fight for taking back power and control in medical freedom?
I think we're just at the beginning, quite honestly. What's happened over time has been a steady progression of loss of freedoms for mothers and families regarding their children's health. And much of this is stemmed around the childhood vaccine program, which I don't know if any of you have been following this. The number of vaccines have just absolutely multiplied exponentially over time. And states progressively are demanding, in fact, mandating that all of these vaccines taken, for children to attend school. And in 2000, the Association of American Physicians and Surgeons, that's a chartered organization I belong to, it's largely some of the top doctors in America, published a memorandum on this saying none of the vaccines are sufficiently safe or effective to ever mandate. And everyone should always have a choice if there's any opportunity for harm, any opportunity. And in the 1986 Vaccine Injury Compensation Act legislation, they used the term for vaccines, unavoidable harm. And so when COVID came in, we saw this go on, basically just explode regarding side effects and people becoming very concerned.
Yeah, absolutely. And kids always at the brunt of it, right? Kids, we even saw, one of our pediatricians, Dr. Renata Moon, she testifies to the fact that children don't suffer from COVID-19 like some of the adults, the elderly adults, so why on earth would we even vaccinate? It's very strange. Kimberly, what do you have to say about that?
Yeah, absolutely. So, I think pediatricians, there are some really great pediatricians out there, but overall, the profession has been bought and paid for, in my opinion. A lot of people don't realize that these physicians are financially incentivized, sometimes to the tunes of hundreds of thousands of dollars, in order to stay in compliance with the CDC schedule. And like I like to tell people all the time, these wellness visits, they go in and it's nothing more than pushing these jabs, the childhood vaccines, the COVID vaccines. Listen, parents can weigh and measure their children all on their own, and they can track the milestones on their own. And then we can go to a physician, a trusted physician when they're ill. So I think it's really important to understand that the pediatricians, again, there are some good pediatricians out there, but most of it is just they're shilling for big pharma.
And the same for your veterinarians. If anybody's noticed, my dog recently could not get a shampoo unless they took more vaccines.
It's insanity.
Insanity. We were just talking about this. What's going on? So let's move on to another question. I hope this is the one that's a tearjerker for me, but during the time of masking and social distancing and other tyrannical measures, I, as a mom, had to fight the school board for my children's freedom to breathe and to have any form of social interaction. I wanted them in school. I didn't want them learning on the computer. I even had to fight to bring them to a birthday party. Who needs to wear a mask, who doesn't? Dr. McCullough, what advice do you have to us moms out there if we ever get in this situation again?
Let's hope we don't, but currently what the CDC says, just so you know, is that the only time we would need to wear a mask is when we're in hospital respiratory isolation with an acutely sick patient, as we would with tuberculosis or any other illness. That's it. That's it. So this week in my practice, I saw acutely sick patients with COVID, didn't wear a mask, didn't do any of these things, because I don't have to, and they don't work anyway. So if anything we've learned on this is that we have to use our common sense and get back to kind of usual rational things. It was never rational for people to walk around who are perfectly healthy wearing masks.
And so about the social distancing, or even masks, I mean, how do you keep a 5-year-old with a clean mask on? And I'm not talking the ones you can sew on the sewing machine. This would be an N95, to my knowledge, is the only fitted N95 would be the only one that would actually might work. So, Kimberly, what do you think about it? Isn't that a little ridiculous what we did to our kids?
It is. It's absolutely ridiculous, and it's all about control. And if all you have to do is Google the size of the virus versus the size of the fabric of the mask, and you can understand that everything is getting in there. So it's not protecting from anything. It's about control. And I think that the most important thing that we need to do is understand that the power lies with the people. It does. It always has. And we just need to start waking up to that and understanding the power that we do have. And unfortunately, too many people cowered. Too many people just kind of went along with the insanity and the absurdity. And there are people that are doing it today, and we just need to stand up. But I think, it's important to understand that we have to be okay with being uncomfortable. Until you become okay with being uncomfortable, you're always going to be their slave.
Yeah, I remember we had organized a large group at my son's school to protest against it, and the school board came behind us and forced the school. But it was a charter school, which is odd to me, right? So they didn't have to follow the school board. So this charter school did it anyway. And even though all the parents stood up, we had more than half of the parents demanding that it just be an option. And they still changed that. And we found out it was a lot of money that the schools got for masking.
Yes.
And that was interesting to me on this whole journey, because it seems to kind of all relate back to money. So we talked about this a little bit before. We talked about the childhood vaccination schedule a little bit when we first started. And I know at our primary care center, we've had a large amount of parents that have come in seeking some help because they've been fired from their pediatrician. And that's interesting. I'm like, how do you get fired? and it's because of what you were talking about. So you brought up a good point, and I think maybe if you could dive into it a little bit more about what goes on behind the scenes. You know, we see a lot of, you know, we hear about these reimbursements from insurance and stuff, but really what's transpiring, there are goals that these pediatricians and doctors' offices have to hit in order to get money again. So would you guys, I don't care if you want to go, Kimberly?
Yeah, and there's a certain benchmark. I don't have the numbers off the top of my head, but it's pretty high. It's a very high percentage of their practice that needs to be in compliance with that CDC schedule in order to get that reimbursement. I think Blue Cross Blue Shield was 40,000 perhaps, and that's just one insurance. So that you think about how many different insurance companies there are that are offering these types of financial incentives. You can see that it's very lucrative for these physicians. But like you said, everything ties back to these financial incentives. A lot of, you know, why I left my career as a bedside nurse was what I saw happening inside the hospitals. Hospitals are not safe places. They're just not. And they are, I mean, from COVID test, which is really truly putting a bounty on your head. I don't advise you to get a COVID test, because you have that bounty on your head, and from test to toe tag, those hospitals are making, depending on the state you live in, up to almost $500,000 in financial incentives. They're keeping patients on ventilators, and if they keep them on ventilators for 96 hours or more, they get more financial incentives. It's remdesivir, ventilator, death, and that's what I saw over and over again in these hospitals.
Oh, yeah. I have another question following that one after this one. Dr. McCullough, why are you standing up and speaking out, and why are more doctors not doing what you're doing?
You know, this week I was invited to the U.S. Senate, and I turned down Senator Ron Johnson because, you know, I told him, listen, get new people there at the Senate. Some of you saw, it was kind of a lot of cast of stars, Laura Logan and Brett Weinstein and Del Bigtree, and, you know, really a whole bunch of you know, eclectic public figures. But what I would ask Senator Johnson today is the same thing. Where's all the senators? Where's all the senators? I would say the same thing to you right now. Where are all the other mothers? Where's all the other families? The same question applies. Somehow we found ourselves in a great controversy where some people seem like they can see things clearly and others cannot. And one of the ways you can tell is if you strike a conversation regarding one of these topics, you can tell when someone is in this form of a trance or a false narrative, is they'll simply say, they'll get uncomfortable, and then they'll say, I don't want to talk about it. That's code word for something is wrong. Why can't we talk about it?
So what would you guys say? What would be your inspirational comment to have more doctors, more nurses stand up and speak about it? And if they did, I mean, explain to us what's so different about you guys being truthful and them hiding in the back.
Yeah. I think it's important, and it's important to come at people, and the way you approach people is everything. And I just like to ask thought-provoking questions of people. If you come at people and you're attacking people and their belief system, they're going to shut you down. They're not going to listen to you. You've got to start asking thought-provoking questions. One that I ask very often, I worked through the ICU through the pandemic, and I asked people, you know, if the virus alone were killing people, then why weren't we pulling bodies from homes and off of the streets? Think about our homeless population that weren't receiving any treatment at all. Right? The only place that anyone was dying was in our hospitals, and not enough people are asking why is that. So.
I would answer that by, I think it's very important that patients and then followers of doctors who are public figures actually start to really give the direct feedback. I don't know if anybody saw it this week, but it was on my my Substack and on my Twitter. Everyone should follow me on Twitter, by the way. I'm nearly over 1 million followers. And I was someone who, I told Senator Johnson back in 2020, I didn't even know what social media was. I thought it was for kids, and I had never been on social media. But at any rate, on my Twitter was Dr. Annette Bosworth. Have you ever heard of her? Dr. Boz, she promotes the ketogenic diet. And she comes out and she capitulates, you know, on her show. She said, for 2 years, my my followers have been telling me the vaccines aren't safe. They're seeing blood clots, heart damage, cardiac arrest. And she goes, I wasn't listening. She goes, she said, I had my children vaccinated. I had everyone close to me vaccinated. And now I am telling you, I've changed my mind. And I put this out there as a sentinel event, being that we got 1 million doctors in the United States. The estimates are initially only 500 doctors knew what was going on. We were the ones treating patients. We may be as much as maybe 20,000 or 40,000 doctors out of 1 million. We have a long way to go. We have 500,000 nurse practitioners who are also in this trance, and we have probably about 7 million nurses. Now, a greater proportion of nurses are, quote, awake, but there's still many who are in this narrative. They all have to come out. What can you do? Is I think when you can do it in a nice way, is when you have a visit with your doctor and healthcare provider, you can prompt it. Say, listen, should I take another COVID vaccine? The CDC says we're on number 9 right now, which they do. This week they announced that. And the doctor said, well, if the doctor says, well, yeah, you should, say, I've looked at it and I'm not comfortable. I don't think they're safe enough. Or, I've already been through COVID 3 times. And give the doctor the feedback. If the doctor says, well, no, I wouldn't take one now at this stage. Well, good, I agree with you, doctor. I've never taken one, for instance. If that conversation happened every single time, I think they would come. And you have to mention it in the waiting room. You have to mention it to the nurses, don't forget. This is very important. Something has gone wrong in the medical and nursing minds right now. We can talk about it's way beyond COVID. There's other things going on right now that are greatly disturbing.
Oh, yeah. I don't know. I call it's like Twilight World. It's very, very odd to me. It's like a psychosomatic. Something's not firing right. I don't know if it's the more vaccines and the less firing that happens. I don't know. So we talked about this just for a moment with you, Kimberly. But this is a major issue. It's a life and death issue. One that all of us are susceptible to, but it's the hospitals. And it's what's been going on inside the hospital doors. One of the reasons why I have the clinic and I wanted to be the medical specialist here and I wanted to run for hospital board is because people are scared to death to go to the hospital.
And they should be.
They're afraid. And we talked about the incentivization, right? So we know that for every COVID test, they get money, the hospital does. For every COVID positive, they get money. For every COVID admission, they get money. For remdesivir, they get money. For intubation, they get money. So it's just this stockpile of money. So you kind of, you can't help but look at the hospital and say, so are you pushing people to be positive? Is that why they were running the cycle rates of the PCR test so high? There's so much mystery around the exact motives. But what do you guys, as a mom, I'm scared for my kids, the cuts, bruises, falls, all that stuff. And I haven't, luckily, not had to take them in. But what do you guys think about the hospital system as it pertains to children? Are they as impacted by being a scared person going into the hospital?
Yes, and I will tell you, it's so important to have an advocate in place and have an advocacy plan in place. Children especially are at risk. If you look at, we just advocated at Remnant, we advocated on behalf of a 4-year-old child who was medically kidnapped. And the only crime that her mother had was asking for them to use a gentler diuretic. They threw this baby into kidney failure. They threw her into renal failure. She went in with an E. coli infection, and they gave her, they were trying to mass flush this infection from her system, and they gave her a cocktail of very, very aggressive diuretics, Lasix, Bumex, and there were a couple of others. And they ended up putting this little 4-year-old girl into renal failure. And it was one medical intervention after the next, this cascade of events that occurred that just kept on going down and having this baby decline. And all the mother asked was for maybe a gentler diuretic, like a hydrochlorothiazide, be used. And for that, for her advocating for her child, they contacted CPS, Child Protective Services, and tried to have the parental rights removed from this family. So and I've been contacted at least 3 times in the last month. Similar stories, a child that was diagnosed with cancer, and the family just wanted a second opinion, and wanted to find out about alternative therapies. Because the standard of care in this country is chemo, radiation, and surgery. That's it. If you ask about alternative therapies, they put a restraining order. They contacted CPS and they put a restraining order against this mother so that she could not be in there with her child advocating. So it is very, very dangerous. When I see parents, a lot of times will go into the ER for things that are not necessarily an emergency. And we need to stop that because it is not safe. It is not safe for many reasons. But to your point, I lost it. Sorry. I had it was right there.
You were on such a good roll.
I was.
Let me just say that these COVID tests can remain positive for many, many months after the infection. So probably if we tested everybody in the audience, there's going to be some of you who are positive. The CDC wastewater data shows that the wastewater is broadly infected with SARS-CoV-2. We've had it for 4 years now. So we should only get a test when someone's acutely ill and is going to make a difference. So they better really look like they have acute pulmonary COVID to get a test. And as a parent, my advice, if a child comes in with an ankle sprain or a case of possible appendicitis or something like this, simply decline the COVID testing. Say, no, my child doesn't have COVID, decline the test. Because if the test is positive, this whole sequence of losing your rights and going into isolation and all of that happens, and one quickly loses ability to control what's going on. So I think it's key to decline the testing and say, listen, I'm declining this. For therapeutics, when it's acute COVID-19, everyone should know the World Health Organization in November of 2020, and they reevaluated it in May of 2022 and published it in Lancet. They say do not use remdesivir to treat COVID-19. This is very important. Do not use it because it doesn't reduce mortality, and some people it causes liver and kidney injury, and that can be in the causal pathway to death. So you've got a major worldwide body that right now disagrees with the NIH. That's okay, but as a caregiver and a legally authorized representative, you need to establish these boundaries. Do not use this product. There are plenty of safe drugs that we can use to get somebody through the illness.
Can I just say one more thing? Because I think this is something that we don't talk about enough. But we have, with so many of the population being vaccinated with the mRNA spike protein, we don't talk about how we've completely tainted our blood supply in this country. That's a real problem. It's something that we don't talk about enough. And I just want to talk about how we do partner with an organization called Pure Blood Registry. And my organization at Remnant Healthcare, we advocate and we help to procure clean, unvaccinated blood for directed donation, and we facilitate that entire process. Yeah, somebody didn't like that. But yeah, it's that's something that we don't talk about enough, and we really need to continue having these conversations.
Absolutely. Absolutely. I know a lot of people are afraid of that very reason of going in the hospital and needing a blood transfusion. How do they know they're not getting vaccinated blood?
Right, they don't differentiate between vaccinated and unvaccinated blood.
Yeah, and you should see when you ask the hospital staff about that, the looks that they give you, it's like we're cuckoo. Yes. So you had brought up, part of the hospital, Dr. McCullough, with the protocols that they're doing. They're still doing those same protocols: remdesivir, intubation, and ultimately kidney failure, renal failure, death. So what is it going to take to change that the inner working of the hospitals? What is it going to take?
We need, I think, at the state level, and I've advised the state of Texas and many others, the state Health and Human Services committees have to call out the hospital CEOs and start having some post-mortem exams on what happened with hospital care. Do you know no single hospital claims to be a center of excellence for COVID-19? None of them. None of them had a better protocol than another one. all hospitals have different protocols, and they compete with one another for patients and to be the best. And when I went on Tucker Carlson, I said, there's no Mayo Clinic protocol for COVID. There's no Harvard protocol. He goes, what? Suddenly, none of the hospitals wanted to be any good at treating COVID. It's inexplicable. They need to be called out. Hospital boards and advisory boards need to call out the chief medical officer, what have you, and say, what are our best practices? What are the rates of the use of mechanical ventilators? So a win would be a patient comes into the hospital, they get high quality medical care, the type of respiratory support they need, don't go on the ventilator and go home. That would be a win. Let's see those positive outcomes. Do you know here in the state of Texas, no hospital has ever published those outcomes? And hospital boards who are independent, they need to call them out on this. These same hospitals want to be the best in cardiovascular disease and the best in cancer, but they're hiding behind their COVID statistics. I think if we actually got hospital COVID statistics out in the open, that'd be the first step.
But wouldn't that introduce lawsuits?
There are lawsuits brewing up, but let me tell you, the defense on this is formidable. In 2005, HHS and Congress wrote the CARES Act. The CARES Act says in the setting of this type of pandemic, which by the way, Secretary Becerra and his predecessor have amended the CARES Act, I think 11 times now. And this is broad immunity. So anything done during the pandemic has immunity from liability suit, according to the CARES Act. People have said, listen, there's got to be a crack in this liability shield. And usually the thought process is, if there's fraud involved, if people are defrauded on what the situation is, and if there's malicious intent, if those things exist, it could be game on for lawsuits. But sooner or later, it's going to come out. And it'd be better off having, maybe these types of meetings occur at the state level, and there's no recordings, people sign non-disclosures and say, listen, we're just going to get in a room and talk about this. At some point in time, discussion will lead to a better outcome. We're not talking about it right now. And as you pointed out, the same things are happening over and over again.
Yeah. Well, we are out of time. You see that wrap up. So we talked about this earlier, we could sit out here all day and have discussions and have Q&A and wonderful stuff. But thank you guys both for everything that you're doing. You guys are huge freedom fighters in your own world in nursing and as a doctor. I mean, this is what we need more of. Thank you guys so much.
Thank you for having us. Thank you.